Hey everyone, Dr. Jacob Robinson, Absolute Chiropractic. Today I want to take a brief moment to discuss wrist health as well as oftentimes a tennis elbow or tendonitis in the elbow. And obviously these are symptoms that could be very debilitating. If you can't move your wrist very well, or if you're getting pain, especially just down from the elbow is what we're discussing today. And they're tough situations because often the commonly used therapies to fix them don't work. And I want to talk today about some easy things you can try that have a high rate of success, at least in my clinical experience, and also some of the things we've learned through trial and error. Now, not every wrist condition is going to fall into this category or be perfectly treated this way, but it's a great start, and if you can try these tips, go for it. So one of the problems with the wrist and the elbow is muscle imbalance. We get really strong on the flexor side of the forearm, and as a result, we're weak on the extensor side. That makes total sense for everybody, because everything we do involves flexion of the hand. You know, whether it's playing the piano, cutting vegetables, or typing on a computer, all day long we're flexing. There's not a lot of activity involved in extension and getting those fingers back. That is the role of the extensors, pulling the fingers back, and if we can make those stronger, we start to eliminate some of the tendonitis issues, or just wrist pain in general, because the wrist also, when you flex, our wrist comes forward more and more. You'll know you're a candidate for these two tips if, when you wake up in the morning, you find your hands curled in and your fingers curled in. If that's your normal resting position when you're waking up in the morning, that may be a clue that you need these tips. So probably the easiest one I can share briefly is putting your palms together and holding your fingers separate. So you can see that that's it looks easy right now. It actually might take some effort for some of you, and if this is easy, we'll go to the next step in a minute. But try holding this position for a minute, and you should start to feel some kind of burn in the extensor group. Now, again, if you don't feel a burn, we'll go to the next step. But if this is tough for you, just do this. And if you're watching a show at night, do this during a commercial break. Now, if you want to up the challenge without any extra tools, start bending the elbows out. So the farther the elbows go out, the harder those extensors have to work. Obviously, this is going to be easier than that. Last protocol is with a rubber band. So holding your hand like this is actually a really good starting point. However, that's a little easy for most of us. And notice my wrist is straight. I can make this harder by bringing my wrist backwards, and that's also a good place to start. If you're still not feeling the burn within 1 minute, you're ready for a rubber band. Really easy. Put that around your fingers, do the same thing, and then start to extend the wrist. And if you can't extend the wrist, that's fine. That's a good starting point. Progress until you can get farther back. The farther back you get, the stronger these extensors get. And try to make sure every joint in the fingers, every finger, is slightly bent. You don't need straight fingers. Straight fingers actually eliminate some of that stretch. And we want all of them engaged. There's some tendons that go to the first joints, and then there's some tendons that go to the last joints. Needless to say, engage all of them by keeping the fingers extended. So I hope that helps. 1 minute a day, if this is an issue for you. And if it's not an issue for you, great. Obviously, keep it up. But test yourself out once in a while. Make sure you're not getting weak on those extensors so you can prevent future problems. Hope you have a great day. Talk to you soon.